most of the time when you see bony growths, they are occurring at the more stable bones, while more disorders with the joint and joint cavity would be seen with the most movable joints. Okay? Thank you.
Do you need a water break?
I inhale something.
That's the bone spasm.
No, that's bone spasm. When you have bony growth, that's bone spasm, and when you have excessive fluid in the joint, that's going to be your box spasm. Usually, bone spasm, when you palpate that structure, you find it slightly hot when it is box spasm, because you have inflammation going on there, and you have accumulation of fluid in the joint. But then you may also have other synovial structures affected, like you have tendon sheath of this muscle, tendon sheath of the other ones, as well as tendon sheath on the dorsal aspect. They might as well be affected. So you have to really localize and you have to really observe it carefully, whether you see that swelling in the linear fashion or so, or if you see the swelling all over. What would be the best indication of that? The pouch that we use for injection into the joint is the most distensible part of the joint cavity. And so that part would be distended more and more when you see box spasm. But if that part is not really well distended and you see still swelling around the joint, then you might suspect something with the tendon sheath. Okay, so that's regarding the this reciprocal apparatus, patellar locking system. Let's look at some of the ligaments of the stifle joint here, that whatever we can see. Okay, so that's the medial side. We can always look at the larger ridge of the trochlea to identify the medial aspect, and so that is your medial collateral ligament. What about the relation between medial collateral ligament and the meniscus there? The meniscus is attached to the medial collateral ligament, the medial meniscus. Well, the lateral meniscus, as you have your popliteus tendon originating from here going backward underneath the lateral collateral ligament, this muscle is going to go this way and get attached here. So that muscle is interposed between these two, so you cannot have attachment between the lateral collateral ligament and the lateral meniscus. So what do we do then? The lateral meniscus has an additional attachment with the femur that is called meniscofemoral ligament.
The lateral meniscus has
Yeah, the lateral meniscus has that support from the femur, that is meniscofemoral ligament. Okay. Now that should be differentiated from your cranial and caudal cruciate ligaments. Okay. So when I try to extend that joint completely, I can see the cranial cruciate ligament attached right here. Okay. So that's the cranial cruciate ligament. Let me see if I'm pointing to the same. So that's the cranial cruciate ligament. Let me see. When I try to extend it furthermore, this is your caudal cruciate ligament. But usually, when you have overextension of the joint, the cranial cruciate ligament would also help preventing overextension. And when it overflexion of the stifle, both of them they would be able to help or prevent overflexion. But again, as we said, overflexion is not much possible because you have bulk of the muscles on the caudal aspect of the stifle. You have the popliteus muscle located right here, which would not allow that much flexion of the stifle joint. But extension is possible, which is prevented by the cranial cruciate. And that's why in dogs, most common injuries that we get is rupture of the cranial cruciate. The caudal cruciate seldom ruptures also. The cranial cruciate is most of the time affected because of its responsibility of preventing overextension, which is more likely to happen. Okay? Okay, guys. So we saw the peroneus tertius, superficial digital flexor. Then, if you see like some space there, that's going to be your subtendinous bursa between the calcaneal bone and the gastrocnemius tendon, as well as bursa between SDF and gastrocnemius, and then third bursa between the skin and the superficial digital flexor. Capped hock. Okay. In the forelimb, same condition is called capped elbow, because we do have at least two bursae at that point. One between the olecranon bone and the triceps brachii, and other between the triceps brachii and the skin. Okay. Usually in what is it, draught horses, like when those which are used for work, these bursae are more effective as compared to the sport or race animals. Okay. Okay, so let's come back to the nerves. Okay. So the three major nerves supplying the hind limb, those are femoral, innervating all the quadriceps, as well as some sort of cutaneous innervation by means of saphenous nerve. Then we have obturator innervating all the adductors, and then we have the ischiatic nerve by means of its two major branches. Okay, so let's follow the ischiatic nerve first. If we could really translate this one, reflect this more backward, or maybe detach it from the let's do one thing. We need to see one more structure here. The trochanteric bursa.
Do you need a scalpel?
Yeah, we just need. Can you ask Matthew? Like, he might give us one.
He's so cute. There's the cutest person ever.